I have proper PPE and my scene is safe. According to dispatch, my nature of illness is difficulty breathing and pressure in the chest. This is my only patient. I will be requesting ALS, and how my patient is seated, we do not need to consider C-spine. So my general impression is we have an 18-year-old male in a tripod position having difficulty breathing. He is alert and oriented ×4. And now I'm going to be getting his chief complaint. Hello, sir. My name is Karla Covarrubias. I'll be the EMT assisting you today. What seems to be the problem?
I'm having pressure in my chest and difficulty breathing.
Okay. So after getting his chief complaint, we're going to be moving on to ABCs. A being airway. His airway is open since he is talking to me. I can't hear any wheezing or any stridor, so there's no obstruction in the airway. Next is B, breathing. So we're going to be looking for a respiration rate, which we have a respiration rate of 28 breaths per minute. Now we're going to be listening to lung sounds. Can you take a deep breath for me? Another one. Another one. And another. Okay. We do have wheezing on all areas of the lungs. And now I'm going to be putting my patient on a non-rebreather mask on oxygen, 15 liters per minute. Okay. Now we're going to move on to C, which is circulation. So I'm going to be looking for a pulse. We have a pulse rate of 96 beats per minute. Now I'm going to be looking if there's any bleeding. We don't see any major bleeding. There is no bleeding. Now I'm going to be looking at his skin. His skin does look pale. He has dry, warm skin, and there is no cyanosis. So now we're going to label our patient as a priority patient. And now I'm going to be getting a history, starting with OPQRC. So, how long ago did this start?
About an hour ago.
Okay. Does anything make your pain feel better?
If I stay sitting like this.
Like in a tripod position?
Yes.
Okay. Can you describe your pain to me?
It just feels like pressure. Like
pressure? Okay. Does it move anywhere else rather than in your chest?
No, it just stays in the chest area.
Okay. On a scale of 1 to 10, 10 being the worst pain you've ever felt, how would you rate this pain?
About a 7.
Okay. And how long has this been going on for?
For about an hour.
Okay. So now I'm going to be moving on to sample. So you said that your signs and symptoms are difficulty breathing and pressure in your chest?
Yes.
Yes. Do you have any allergies?
I'm allergic to peanuts.
You have an allergy to peanuts? Do you have, are you taking any medication, any over-the-counter, any prescription drugs, any herbal, any non-recreational drugs? Recreational drugs, sorry?
No, I'll just be taking an inhaler.
Inhaler?
Yes.
So your inhaler is the only medication you're taking?
Yes.
Okay. And do you have any past medical history?
I do have asthma.
You have asthma? Okay. What was the last thing you ate?
I ate enchiladas about at 11 a.m.
Around 11 a.m.?
Yeah.
Okay, and what were you doing when this started?
I was just playing video games.
Okay. Okay, playing video games. So now I'm going to be rechecking his lung sounds. So can you take a deep breath for me? Another one? Another one? And last one? Okay. There is still wheezing in the lungs, but he is having less difficulty breathing after we put him on oxygen. So now I'm going to be getting a set of vital signs, starting with his pulse rate. So let me get his pulse rate. I have a pulse of 98 beats per minute. Now we're going to get a respiration rate, which I got 20 breaths per minute while I was checking his pulse rate. And I'm going to be getting a blood pressure now. Okay. So I got a blood pressure of 116/74. So my impression of my patient is that he is having an asthma attack. If he had his inhaler with him, I will now assist him with his inhaler. And after assisting with his inhaler, I would put him back on 15 liters of oxygen via non-rebreather mask, rechecking his vital signs, which are blood pressure, pulse, respiratory rate, and also keep listening to his lung sounds until ALS arrives. Now that ALS has arrived, I'm going to give him a report of my patient. So this is an 18-year-old male patient with a chief complaint of difficulty breathing. He has a past medical history of asthma. His only allergy is peanuts. He does have an inhaler for his asthma. His last oral intake was enchiladas around 11 a.m. And he was just playing games when this started about an hour ago.